Welcome to Module 5. In this presentation, we're going to look at standards development organizations and explore SNOMED CT. In Canada, one of the main organizations which promotes standards is Canada Health Infoway. Infoway works to advance digital health in Canada. Digital health includes the use of information technology and electronic communications tools, services, and processes to deliver healthcare services or to facilitate better health. Their mandate covers the EHR, EMR, clinician e-services, consumer health e-services, public health surveillance, and telehealth, to name a few. Infoway plays an important role in bringing together stakeholders and facilitates pan-Canadian multi-jurisdictional collaboration, sharing, and networking to move the Canadian digital health agenda forward. One of the ways Infoway does this is with the Standards Collaborative Working Groups, or SWGs. There are 10 of these working groups, and people are encouraged to participate as volunteer members, especially if they have a particular knowledge of an area or interest in it. The scope of the working groups is to review and provide feedback on health information standards and architecture activities. And this can happen at any point throughout the standards lifecycle, so it could be early on when the standards are being developed, or it can be later when the standard is implemented and when it's undergoing maintenance. Other areas are also included within the scope. For example, CHIMA's new terminology standard specialization was posted up into one of the Standards Collaborative Working Groups in order to achieve feedback and participation from CHIMA members in developing the curricular competencies. Oversight of the working groups is provided through various Standards Collaborative governance committees, and they provide both direction and guidance to the groups. Issues that arise during SCWG meetings are brought back through Infoway's Standards Collaborative subject matter experts for feedback and for resolution. The 10 primary Standards Collaborative working groups are public health, individual care, managing the health system, medication management, labs, infrastructure and architecture, non-clinical registries, IT privacy and security services, terminology representation and services, and diagnostic imaging. In addition, other communities may be created depending on need. For example, a separate community was created for the work on the terminology certification. Infoway also includes InfoCentral communities. These communities were designed to foster open, inclusive participation and to allow people to collaborate and communicate on various interoperability topics. Diverse perspectives are encouraged within the communities, and some of the activities that they include are news, educational sessions, the ability to connect with experts in a variety of different subject areas, the ability to host meetings. So for example, when work was being done on the CHIMA terminology certification, meetings to discuss it were able to be hosted through the InfoCentral communities. It's a place for healthcare organizations to share lessons learned, and it provides both new documentation in the interoperability arena, as well as maintains an archive of historical documentation. As you can see from this slide, there are many different communities within Infoway, and this is a dynamic list. It changes as needs arise to have new communities added, or if ones get outdated and are no longer relevant, they are removed. So some of them include clinical operability strategy, clinical requirements, coordination of care, diagnostic imaging, enterprise solutions and integration, HL7, integrating healthcare enterprise, ISO, interoperability standards, ITAC health, laboratory, medication management, P-Claudin-Loink, public health surveillance, and SNOMED CT. If you're interested in these communities, I encourage you to go out to the Infoway website and do some exploring. Infoway represents Canada to several international standards organizations. It adopts and adapts these international standards so that they can act as the basis of our pan-Canadian health network. Some of the ones it represents you're very familiar with, such as CCI, ICD-10-CA, HL7, and SNOMED-CT. In addition, they represent DICOM, which is the Digital Imaging and Communications in Medicine standard, and it's a standard for distributing and viewing any kind of medical image regardless of its origin. They also handle ISO TC215, which is a standardization in the field of health informatics. It's used to facilitate coherent and consistent interchange of health-related data, information, and knowledge to support and enable all aspects of the health system. Infoway represents LOINC for Canada and has worked to adapt it to PCLOD, which is our Pan-Canadian Laboratory Observations Database. There are also other standards which are represented, such as the Unified Codes for Unit of Measure, the IHE, which is the Integrating Healthcare Enterprise, and the Health Canada Drug Product Database. The next organization we're going to look at is an international one, ITSADU, the International Health Terminology Standards Development Organization. ITSADU is a not-for-profit organization that develops and promotes the use of SNOMED-CT to support safe and effective health information exchange. As mentioned, ITSADU is an international nonprofit organization, and it determines global standards for health terms. It maintains and grows leadership as global experts in healthcare terminology. And they work to ensure that SNOMED-CT is accepted as the global common language for health terms. There are currently 27 member countries within ITSADU. If you look at the graphic of the government and advisory, you can see that the organization is very well-rounded and far-reaching. There's a General Assembly and Management Board, but under that there are 4 committees: the Content Committee, the Implementation and Innovation Committee, the Quality Assurance Committee, and the Technical Committee. And if you read through the documentation underneath, you can see that each of them contains many project groups and special interest groups that cover a wide range of interests. The purpose of ITSADU is to acquire, own, and administer the rights to SNOMED-CT, as well as other terminology products, which is a general term they use that covers other health terminologies and cross-maps to allied standards or other relevant assets. Canada is a member country in the ITSADU, and as part of that membership, we attend the meetings to support Canadian interests, and we participate in both the deliberations and decisions of that meeting. So we help to shape the future of SNOMED-CT. We use our expertise and experience to help enhance the development and deployment of SNOMED-CT, both in a Canadian and a global perspective. And we participate by conveying our special Canadian position when input or feedback is required on international draft materials submitted by ITSADU. Now that we've mentioned ITSADU and their product SNOMED-CT, we're going to spend some time exploring SNOMED-CT. We're going to take a very high-level look at SNOMED-CT. Within your homework for this week, you're also going to look at 2 videos on SNOMED-CT. As well, you have the option to go in and look at CIMA's SNOMED-CT Primer, which was developed by CIMA as an easy-to-read introduction to SNOMED-CT. And it's considered an essential resource for anybody who's working with electronic health information systems in Canada. So the primer covers a range of key topics, including the evolution of SNOMED-CT, its core content, uses, and customization. So you aren't required to read this for the course, but I did put it up into D2L so you can optionally look at it. In addition, if you have a particular interest in SNOMED-CT, I would suggest going out to both Infoway and the ITSADU sites to gain further information. You should all be familiar with SNOMED from other courses within the program, but just as a review, SNOMED stands for the Systematized Nomenclature of Medicine, and it's a defined system for naming. The current version is SNOMED-CT, where the CT stands for clinical terms. And it's a comprehensive, precise, clinical reference terminology. SNOMED CT is intended to provide a set of concepts and relationships that offer a common reference point for both comparison of and aggregation of data. SNOMED CT was designed for use within an EHR, and it supports areas such as clinical decision support, CPOE, and critical care monitoring. In order to realize the benefits of an interoperable EHR, it's of paramount importance that common clinical terminologies are used for any health information that needs to be shared among providers. This enables electronic healthcare systems to understand one another's data, facilitating semantic interoperability. And as a reminder, semantic interoperability of computer systems allows them to communicate using the same inferences for the same information, that is, to share unambiguous meaning. Let's start off with a little bit of a look at the history of SNOMED. SNOMED was actually developed from two primary roots. The first was the College of American Physicians. In 1965, they developed the Systematized Nomenclature of Pathology, or SNOP. Then in 1975, SNOP was expanded and it became the Systematized Nomenclature of Medicine, SNOMED. In 1979, SNOMED 2 was published, and it was the most widely adopted version of SNOMED up to that point. In 1993, there was a major expansion, which made it become SNOMED 3.0. In 2000, in collaboration with Kaiser Permanente, the College of American Physicians developed a new logic-based version, which they called SNOMED RT. Historically, SNOMED was strong in its coverage of medical concepts. With SNOMED RT, there was over 120,000 concepts included. The other route for development was the National Health Service in the UK. In the 1980s, Reed codes were developed by Dr. James Reed, and these eventually evolved into the Clinical Terms version 3, or CTV3. CTV3 was strong in terminologies for general practice. It had 200,000 interrelated concepts, and it was used for storing structured information about primary care encounters in individual patient-based records. In 1988, a 3-year project was initiated in order to merge CVT3 and SNOMED RT, and this was done by the College of American Physicians. In 2002, the first version of SNOMED CT was published. And that's an important date, so make sure you keep that one in mind. In 2003, the National Library of Medicine entered into an agreement with the College of American Physicians to make SNOMED CT available at no cost through their Unified Medical Language System, Metathesaurus. This was a very important step because this guaranteed there would be a much wider spread of SNOMED CT by removing the licensing fees. In 2007, the newly formed ITSADU acquired the intellectual property for all versions of SNOMED, and they did this in order to better promote its adoption and use. ITSADU is now responsible for the ongoing maintenance, development, quality assurance, and distribution of SNOMED CT internationally. SNOMED CT is a multinational and multilingual terminology, and it can manage different languages and dialects. It's currently available in American English, British English, Spanish, Danish, and Swedish, and there's other translations underway or nearly complete, including French and Dutch. SNOMED CT cross-maps to other terminologies, such as ICD-9-CM, ICD-10, ICD-03, and LOINC. It also supports ANSI, DICOM, HL7, and ISO standards. SNOMED CT is currently being used in a joint project with the World Health Organization, where it's being used as the ontological basis for the upcoming ICD-11. And it's interesting to note that ITSADU considers SNOMED CT to be a brand and not an acronym. In order to understand SNOMED's roots, we have to look at SNOP. So the Systematized Nomenclature of Pathology is still widely used across the world. It's been found to be extremely useful for the computerization of medical records. SNOMED is based on the philosophy of SNOP. SNOP is a four-axis system. All pertinent terms are grouped into four categories. These include topography, which is the anatomy, morphology, which includes pathologic anatomy and disease process, etiology, agents causing disease, and function, the functional disorders in the pathophysiological sense. Let's look at how SNOP and SNOMED compare as to the number of axes and what they are. So as we saw in the previous slide, SNOP has four axes: topography, morphology, etiology, and function. SNOMED adds two additional axes. The fifth axis is the classification component of the system, and it has a list of complex diseases or syndromes. It's in this category that we can do statistical reporting of diseases and syndromes. The sixth axis of SNOMED is a procedure category, and it's an attempt to list all procedures used in the healthcare system so that they can be directly related to and integrated into the universal coded nomenclature. We've explored the history and roots of SNOMED. We're going to take a closer look at the current product, SNOMED CT. Let's start off with a few SNOMED stats. SNOMED contains 366,170 healthcare concepts with unique meanings and formal, logic-based definitions. It has 993,420 descriptors and 1.46 million semantic relationships. In other words, SNOMED CT is very large and probably has a descriptor for anything you want to define. As mentioned, it's available in a number of languages, with additional languages in process for translation. SNOMED CT-enabled records allow healthcare providers to take advantage of advanced and robust clinical decision support as the result of having computable or codified data at a very granular level. This coding standard is critical to free the data from the different silos of health information islands. And this means that information using SNOMED CT can be easily shared in a timely and accurate manner across different healthcare providers, settings, and geographical boundaries, and throughout the continuum of care. SNOMED can benefit individuals, patients, and clinicians through clinical assessment and treatment. And some of the areas where these benefits are felt is in tracking a patient's progress, and that can be done by integrated tools instead of chasing a paper trail of healthcare. Also, the completeness of the terminology makes it easier to code clinical concepts in a standardized way and at the level of detail. It also means that key up-to-date data for each patient is available at the time of care. For patients, there's increased access to standardized patient clinical data, which helps to increase the response of care delivery at the point of service. Updated patient data is also easily available to healthcare providers, which leads to improved patient safety due to access. SNOMED can benefit populations by facilitating population monitoring and making it easier to aggregate information and to track both the incidence and prevalence of disease. SNOMED CT supports research and evidence-based medicine by reducing the variability in the way data is captured, encoded, and used. This standardized information makes analysis easier. In addition, SNOMED supports the development of comprehensive, high-quality clinical content. It standardizes the way to represent clinical phrases. It enables the automatic interpretation of phrases and facilitates the evolution and growth in expressing emerging requirements. SNOMED captures clinical information at the level of detail needed by clinicians for the provision of care in all healthcare disciplines and most healthcare settings. This is a key benefit, so it's one you should try to remember. As a terminology, SNOMED has many desirable features that make it a good clinical vocabulary. I'm going to go through a few of these, and you probably will not understand them yet at this point, But as we move forward through this lecture and explore SNOMED in a little more depth, you'll get definitions for these. So it has non-semantic concept identifiers. It's concept-oriented. It recognizes redundancy, and it has multiple granularities and consistent views. So what does all this mean? SNOMED enables healthcare organization to develop analysis applications to do things such as conduct outcomes research, to evaluate the quality and the cost of care, and to assist in designing effective treatment guidelines. Why do we need SNOMED? We have lots of problems with medical language. SNOMED CT is an initiative that tries to help overcome the limitation that healthcare data is textual and contextual. Medical records have a lot of information in them, and a lot of time there are issues with the terms that are found within the medical record. For example, there is ambiguity of terms. Take an entry like "the patient is unwell." This term is vague. It could mean almost anything. There's a lack of precision. You may find a medical record with a documentation of a patient having a large gash. What constitutes large? What means large to one person may not mean large to another. There are issues with synonyms, so words that have identical or similar meanings, and these are rampant in medical language. Also, we have issues with unstructured information, so information with no logic structure, and this causes a lack of semantic interoperability. And just as a reminder, semantic interoperability is the ability of systems to exchange data with unambiguous shared meaning. This contrasts with syntactic interoperability, which is concerned with the packaging of the data and the transmission rather than the meaning of the data. Here's an example of a problem with medical language. If somebody came up and gave you the term cold, what would you relate it to in your mind? Is it a disease where you have a runny nose, a fever, and a sore throat? Or does cold mean a low temperature? Is cold an acronym for chronic obstructive lung disease? Or does it refer to computer output to Laserdisc systems? It could mean any of these things, and you don't have a way to tell without any additional reference. SNOMED helps to solve some of these problems. It standardizes clinical information, or medical terms, to enable more accurate documentation of patient care. And it's important to note that SNOMED CT is designed for use in electronic and not paper-based health record systems. So it's with the EHR that you are going to see these benefits. SNOMED provides common language which facilitates a variety of electronic areas. It facilitates communication between clinicians. It helps with interoperability of the EHR. So the SNOMED CT structure ensures interoperability across various software applications of diseases, treatments, etiologies, clinical findings, therapies, procedures, and outcomes. The breadth and depth of the terminology, as well as the computer-readable hierarchies, enable faster, reliable, and consistent retrieval of clinical information. It allows for clinical alert and reminder systems. This can be achieved when automated methods of data abstraction during the documentation process are used to detect deficiencies in patient care and to provide automatic and rapid feedback to clinicians, thus providing real-time opportunities for improvement at the point of care. It also facilitates computerized provider order entry, which is the standardized capture of the types of diagnostic tests ordered or other orders that are submitted, again, at the point of care. SNOMED fosters the education of medical students, residents, and junior staff by providing problem-oriented, procedure-conscious approaches to medical care. Medical information in all 6 categories have numerical equivalents, and this allows SNOMED to have multilingual dimensions. The basic structure allows the potential for the development of completely automated encoding in medical data in a natural language form. This is something that has the potential to significantly change the HIM profession. When these types of systems have been developed, rather than HIMs doing all of the preliminary coding of medical records, the coding would happen automatically through automated encoding. And HIMs would take on a more senior type of role or a more advanced type of role where we evaluated the coded data to make sure it was accurate and that there were no issues. SNOMED has almost limitless applicability. Clinicians, researchers, and patients can use it to apply information in ways that were previously not possible. SNOMED's highly scalable, so it can be used in a wide variety of healthcare settings, and these can vary from individual clinicians to nationwide provider organizations, so it's fully scalable. It's vendor neutral, and this means that because no one vendor controls its definition, its revision, or specifications, it can be used by any vendor, and because it's usable by any vendors, it gives healthcare organizations the better ability to choose the vendors without loss of functionality. So it avoids the issue where you get vendors who create products that are very proprietary. While SNOMED is comprehensive on its own, it also cross-maps to other medical classifications which are in use: ICD-9-CM, ICD-10, ICD-03, and many others. This cross-mapping means it can avoid the need for duplicate data capture while facilitating enhanced health reporting and statistical analysis. In addition to the classifications which are in use, SNOMED is being used as the basis for ICD-11, the upcoming revision to ICD-10, which should be out in the next couple years. As we've discussed previously, in Canada, Infoway manages the Canadian version of SNOMED CT. There are Canadian extensions of SNOMED CT, and we've developed approximately 35,000 active French-Canadian concepts, which have been added to our version. This was developed in collaboration with federal, provincial, and territorial government representatives. And it's early in implementation within Canada and the rest of the world. It continues to gain momentum in support of EHRs and the related use of health information. If you want to take a look at some of the Canadian successes in SNOMED, there is a website called SNOMED in Action, and I've given a link to that in the presentation. So go out and take a look at it, and you can see what the status of SNOMED CT deployments are in Canada and where they've been successful. Let's start to take a look at the basic structure of SNOMED CT. SNOMED is dynamic. It's not static. It continues to expand as requirements for additional core components are identified. So if we look at the basic components of SNOMED, concepts, descriptions, and relationships, you can see that in 2012, the numbers were significantly lower than they are today. This is what the SNOMED CT design looks like. At the top level, you'll see that we have concepts, hierarchies, attributes, identifiers, descriptions, and relationships. In the upcoming slides, we'll dig into each of these in a little more detail, but for now, we'll just get a general feel for what SNOMED CT looks like. So when we explore concepts, you'll see that the root concept, or the top level, is SNOMED CT. Underneath that root concept, you have a number of hierarchies. The top level hierarchies include body structure, clinical findings, environment or geographical location, events, etc. Attributes are components of relationships, and they're used to link concepts together in various ways. There's four main types of attributes. One is known as ISA relationship. Another is finding site relationship, causative agent relationship, and associated morphology relationship. And we'll look at those in more detail in upcoming slides. Identifiers are numeric tags which are used to uniquely and unambiguously describe each concept. There's two types of identifiers, the concept ID and description ID. We'll explore them further in upcoming slides. The description is a human-readable phrase or term which describes a different concept. So your base concept may be heart failure, which is a disorder. But there are other descriptions which it may refer to, such as weak heart, cardiac failure, heart failure, or myocardial failure. And then there are relationships, which I've sort of mentioned already, but a relationship explores how two different concepts are linked. If we look at the example shown in this diagram, you can see we go from low granularity to high granularity within this set of findings. So if we go upwards, at the very granular or very detailed level, we have arthritis of the knee. Arthritis of the knee is an arthropathy of the knee joint. So you can see we're moving from a very detailed, very specific level up to a level that's a little higher. Arthropathy of a knee joint is an arthropathy. And again, we're going from more detailed to more general. Arthropathy is a joint finding. Joint finding is a musculoskeletal finding. Musculoskeletal finding is a finding by sight. And then finding by sight goes from that low granularity level and links back up into one of our top level hierarchies, clinical finding. We're going to look at some terms which provide some of the foundation for understanding SNOMED CT. The first is concept. A concept is a clinical idea or word which represents clinical thoughts. It's a permanent 6 to 18-digit numeric code or concept identifier. It's also known as a concept ID. These are never deleted from SNOMED CT. If no longer used, they're deprecated. If you haven't heard the term deprecation before, it refers to the discouragement of use of some feature, design, or practice, generally because it's been superseded or it's no longer considered safe. So it's left in place within the system, at least for the time being, and still left there for documentation purposes, but not actually used. And deprecation can also refer to the prohibiting of use of a term. SNOMED CT uses hierarchy for concepts, and they're organized from the more general to the more detailed. So if you remember back to the lecture on classification, this is where you would see the hierarchies of part-whole and parent-child. SNOMED CT concepts allow for detailed clinical data to be recorded and then later accessed or aggregated at a more general level. An example of a SNOMED CT concept would be the concept for chronic obstructive pulmonary disease. And you can see the concept ID is a numeric code 136-45005. Descriptions, in contrast to the numeric concepts, are human readable phrases or names, and they're known as terms. They're associated with a specific concept ID. Descriptions are assigned a unique description identifier or description ID. So you will see that we have two numbers which describe these various terms, the concept ID and the description ID. Descriptions connect a term and a concept. Concepts can have several associated descriptions, each representing a synonym that describes the same clinical concept. So this is where you would see the term for heart attack might have several associated descriptions, such as myocardial infarction, coronary thrombosis, STEMI, and STEMI, etc. There are three types of descriptions: the fully specified name, the preferred term, and the synonym. And we're going to look at each of these in more detail. The first type of description is the fully specified name, or FSN. This description uniquely and unambiguously describes a concept within SNOMED CT. It may not be the most commonly used term or natural phrase. So, for example, heart attack is a very commonly used term, but it is not the one that is selected as the fully specified name within SNOMED CT for that concept. There's only one fully specified name for each concept. And each FSN also contains a semantic tag or hierarchy tag, and you'll see these in parentheses. These indicate where the concept is assigned in the hierarchy. If you think back to the diagram we looked at, which indicated the SNOMED CT structure, you'll remember that there were hierarchies listed. And these started with top-level hierarchies, but also went down, and as you go through the hierarchy, they become more and more granular or more detailed. This means that these semantic tags helps to place where the concept falls within the hierarchy of SNOMED CT. Some examples of fully specified names. The first is hematoma. It has a semantic tag of disorder, and it falls within the SNOMED CT hierarchy for clinical finding. Hematoma is a morphological abnormality, and it falls within the high-level hierarchy as body structure. And then we have chronic obstructive lung disease. And you can see for this one, the semantic tag is disorder. It's not obviously apparent on the list we have as a top level, so it would be a semantic tag that's lower down in the hierarchy. If we go back to look at our previous example of chronic obstructive pulmonary disease in more detail, you'll see that the term chronic obstructive pulmonary disease is actually the description. The semantic tag, as mentioned, is disorder. And you'll also see that it has two different numeric indicators associated with it. The first is the concept ID, which we've already seen, 13645005. It also now has a description ID, 739041012, and this description ID would link to the description chronic obstructive pulmonary disease. The next type of description is the preferred term. The preferred term is a common word or phrase used by clinicians to describe a concept. Each concept will have one preferred term that may or may not be unique to that concept. What this means is that a preferred term for a concept may also be a synonym for another concept. The preferred term is used by clinicians to describe that concept, and it may be assigned and may vary according to language or dialect, meaning that in English, the preferred term may not be the same as the preferred term for the same concept in French or Dutch. So if you look to the right-hand side, this is an example of chronic obstructive lung disease that I've taken from one of the SNOMED CT browsers, SnowOwl. You can see that it lists a fully specified name of chronic obstructive lung disease, and in brackets it has the semantic tag disorder. Additionally, it lists a synonym, which we'll talk about more on the next slide, but the important thing to note is the little red banner that's beside it, which indicates that chronic obstructive lung disease is the preferred term for this concept. So when you talk about these preferred terms, similar ones can be used for different concepts. So for example, cold with concept ID 13645005 and description ID of 739041012 describes chronic obstructive lung disease. Cold of a concept ID of 841620001 and a description ID of 139573015 refers to cold being the sensation. The next type of description is the synonym. Synonyms represent a term other than the fully specified name or the preferred term, and they represent a concept. They are not unique to concepts, so the same synonym can potentially be found
under multiple concepts, but they are only the fully specified name in one of the concepts. They can vary according to language, according to dialect, or by user, and each term may have multiple synonyms. Let's go back to our example of chronic obstructive lung disease. As we saw in the previous slide, the fully specified name is chronic obstructive lung disease with a semantic tag of disorder. The first synonym listed has that red banner, and so it indicates that it is the preferred term. The preferred term is chronic obstructive lung disease. Then you'll see that there are many other synonyms listed. So these are all different ways to describe chronic obstructive lung disease. And you'll see things like chronic airway disease, chronic airway obstruction, chronic obstructive airway disease. So these are the many different synonyms for chronic obstructive lung disease. Looking at this a different way, the example of chronic obstructive lung disease will have one fully specified name, one preferred term, and multiple synonyms. So this is looking at what we just talked about on the previous slide, but laid out a little differently so that you can see the concept IDs and description IDs for each of these. The important thing to note here is that whether we're looking at the fully specified name, the preferred term, or any of the synonyms, they all have the same concept ID. So this shows that all of these relate to one specific concept. What differs for them is you will see that each of them has a different description ID. So the description ID, which relates to the term or the way we can read it, as opposed to the machine readable numerical format, will vary for each of these different ways of referring to chronic obstructive lung disease. The next area we'll focus on is relationships. Concepts in SNOMED CT are organized according to hierarchical relationships. They can also be linked by attribute relationships. In SNOMED, relationships are defined as an association between two concepts, and each of these concepts is identified by their own unique concept ID. There are 4 types of relationships. The first is defining, a relationship to a target concept that is always true from any instance of the source concept. So what does this actually mean? Well, take for example, procedure site equals liver. Liver is a defining characteristic of the concept liver biopsy. This is because in order to do a liver biopsy, you have to have a site of the liver. You can't do a liver biopsy anywhere else within the body. The next type of relationship is qualifying. Qualifying is an attribute value relationship associated with a concept code to indicate to users that it may be applied to refine the meaning of the code. And the term may be here is critical because what it indicates is this is not something that is always required. It can be used, but it's not mandatory. An example of qualifying relationship is revision status equals first revision. First revision is a possible qualifying characteristic of hip replacement, but it's not required. The next type of relationship is historical. Historical associations are ones that link inactive and active concepts. So in our example, you would indicate a historical relationship through the terms replaced by or same as. References are held within a reference table from the inactive component to other equivalent or related components that are currently active. And finally, additional. These are characteristics of a concept that are not part of the definition of the concept. So these are not usually relevant in any national or organizational context, but do provide some additional information. So, for example, we're going to look at in the United Kingdom, the National Health Service puts additional information regarding the legal prescribing status of drugs. And they do this in SNOMED using the additional relationship. So if you look at the example, you'll see amoxicillin 250 milligram capsules, and then has
NHS prescribing status message equal to prescription-only medication. So this is how in the UK they indicate that this particular drug can only be obtained with a prescription, and they indicate it here in the additional area. We're going to break down the defining category a little further and look at the two components within it. The two main types of relationships are ISA relationships and attribute relationships. ISA relationships are also known as parent-child relationships, which is a term you should be familiar with from the lecture on classification. They're also called supertype or subtype relationships. ISA relationships link concepts within a hierarchy, and they relate that concept you're looking at to preceding concepts. All concepts except for SNOMED CT root concept have at least one ISA relationship. And then there are attribute relationships. These are also known as role relationships. They link concepts between the SNOMED CT main hierarchies of clinical finding and procedure. There are supporting hierarchies as well, such as organism, substance, and body structure. And each of them has a restricted set of permissible values or an allowable range of values. We're going to take a more graphical look at both ISA and attribute relationships. So we're going to do this for the concept of bronchitis. So first off, in the descriptions area, you're going to see a little teal-colored square with an F that says bronchitis and in brackets disorder. So that is the fully specified name for bronchitis, along with the semantic tag of disorder. The next box you will see is a teal with a P initial in it, and that is bronchitis. This refers to the preferred term. Below that, we see a number of different relationship types for bronchitis. The first one we're going to look at is fully defined, and this is a series of ISA relationships. So these go from the bottom upwards, and the bottom is the most granular or highest level of granularity or detail. And as you move upwards through this list, it becomes more general. The purple D in a box indicates that this is a description. The lowest level is disorder of bronchus, so this is the most detailed level. It's linked to inflammation of specific body organs, another description, through an ISA relationship. Inflammation of specific body organs is again linked to a higher level description, inflammatory disorder of the lower respiratory tract. The next area under group is where we find attribute or role relationships, and this is a place where there can be linkages to other concepts. So if we look at associated morphology, there's a linkage to a description of a concept, inflammation. Under finding site, we find a linkage to the description bronchial structure. And finally, there's a section qualifiers, which, as you may guess, associates to the qualifying type of relationship. So these are areas where there are conditional things that may be included. And you'll see there's a C in a green box, which indicates this. So when we look at the qualifiers for bronchitis, one of them is severity. And under severities, there are a number of different ones which can be documented. They're optional, which is the O in the blue box for severities, so you don't have to include these, but if you do, there are a number of various ones which are the allowable range of values which you can use. And these include moderate, severe, mild, mild to moderate, etc. Another way of looking at the components we've just talked about is the SNOMED CT logical model. And this gives you a more graphical view of how they all fit together. The logical model defines the way each component and derivative is both related and represented. And it specifies a structured representation of the concepts. the descriptions used to refer to those, and the relationships between them. So you can see of all these components at the center, one of these is concept. Each concept has a SNOMED CT identifier, and concepts are linked both to descriptions and relationships. So let's focus first on the description area, where each concept will have a fully specified name, and one FSN will be marked as preferred for each language. Additionally, concepts may have synonyms. Often, one synonym is marked as preferred for each language, and there may also be a number of synonyms that are also marked as acceptable. So this allows some differentiation or priority of the synonyms as to which ones are more commonly used. Under relationships, we've noted that there are the two different types, is-a relationships, and each concept will have at least one is-a relationship, which links it into that top level hierarchy. And there can also be attribute relationships, and each concept can have as many attribute relationships as are needed to fully describe it. There are a number of tools, generally known as terminology management tools, which are used to support large-scale terminology code systems such as SNOMED CT. They help to develop and manage content. They help with editing terminology subsets and mapping local terms to formal code systems. The first tool we're going to look at is the terminology browser. Browsers are tools that support both the searching and viewing of SNOMED CT, and these can either be standalone or they can be coupled with other terminology tools. We're going to have the opportunity shortly to work with one of the browsers so that you can actually practice looking things up in SNOMED CT. Terminology browsers are considered a type of knowledge base. And although they are knowledge bases, there are also other tools that provide sophisticated functionality to support terminology use in EHRs. Terminology knowledge bases, authoring, editing, and mapping tools are often referred to as terminology authoring and maintenance systems. Some tools are functionality based, and others, such as terminology asset management, refer to tools to support the people processes. These tools support large-scale terminology code systems to develop and manage content, edit terminology subsets, and map local terms to formal code systems. Another type of tool is a template registry tool. So SNOMED CT works with clinical document architecture template registry tools, and these are put out by HL7. The goal of using these tools is to provide discrete data in documents, and work is currently underway to address the use of standardized templates which support clinical data collection. So there's a number of benefits to using standardized templates. It should be fairly obvious that standardizing makes it easier to both share information interoperably as well as to compare and aggregate information. There's the potential for terminology adoption, such as SNOMED CT, and the use of CDA as the standard architecture for documents. And there's much work being done right now in the US on meaningful use requirements. There's significant work being done in the US due to meaningful use requirements. And meaningful use sets out specific objectives that eligible professionals and hospitals have to achieve in order to qualify for Centers for Medicare and Medicaid Services incentive programs. So meaningful use includes achieving using certified EHR technology, and the goal is to improve the quality, safety, efficiency, and to reduce health disparities. It's meant to engage patients and family, improve coordination of care, population health, and public health. As well, it's used to maintain privacy and security of patient health information. Although meaningful use is primarily a U.S. initiative, InfoWay does monitor CDA work in the U.S., and it supports the progress in Canada through the Standard Collaboratives Working Group 2, Individual Care, Delivery of Care. Work has been completed to define report type labeling, as well as to standardize header content in Canada. We're also working with other jurisdictions who have similar clinical document standards or specifications to assess what the future needs may be. Previously, when talking about tools at a high level, I mentioned browsers. We're going to take a little bit of a closer look at the SNOMED CT browsers. SNOMED CT is provided in a form that's suitable for computer applications, and in its native format, it's not immediately viewable to individuals. Therefore, we need browsers to allow us to look at the SNOMED CT content independent of an EHR or any other record or computer system. Browsers support both the searching and viewing of the contents of SNOMED CT, and they may be standalone or they may be coupled with some of the other terminology tools that we've previously mentioned. There are three main types of browsers. The first is a desktop application browser. So they are very good for doing fast searching and detailed display of information, such as the relationship and synonyms. But the disadvantage of them is they are a separate piece of software that does need to be installed on your desktop. Examples of these are ClinicLoo Explore and the SNOMED browser. There are also online applications. These are easy to use and they allow you to access online. They do require an internet connection, but you don't have to download and install anything separately on your computer. You can do it through a standard web browser. And they generally allow you to explore the terminology. Examples of these are NPX browser, Snowflake, and the Itsudo browser. While not as established as the other types of browser, we are seeing an increase in mobile device applications. The advantage of these is they allow you to access SNOMED CT and look things up while you're on the move. Currently, there are no free mobile applications, but this should change over time as they become more prevalent. You should note that different browsers can provide very different ways of viewing. Some provide a list of SNOMED CT terms that match search words, but provide little other information. Some do provide more information about search words, such as synonyms, or the relationship to terms and hierarchies. So, if you're watching this as a recorded lecture, take a pause here and go out and look at browser.itsudotools.org and then www.snomedbrowser.com. They will give you examples of what a couple different online browsers look like. The next thing we're going to do is to do an activity on browsing using a SNOMED CT browser. So if you're watching this as a recorded lecture, let me explain what we're going to be doing with it, and then stay tuned because there is a short video included here that actually walks you through how to use the SNOMED CT browser at a high level. And this will assist you in doing this exercise, and we'll look up the first term as part of doing that. So what we're going to be looking at is the statement. This 85-year-old female was admitted via the emergency room from the nursing home with shortness of breath, confusion, and congestion. There was no history of fever or cough, and the patient also has a history of senile dementia and COPD. So if we were to pull concepts out of that SNOMED CT would be familiar with, the ones we're going to come up with is year, old, female, ER admission, nursing home, shortness of breath, onset of confusion, congestion, no history of, and history of. For the exercise, you're going to look up each of these in the SNOMED CT browser and document the SNOMED CT ID that you find for that term. Before you go off and look up the rest of the terms, let me walk you through how to look up the term year in SNOMED CT browser, as well as provide you with a brief summary of how to use the browser itself. Let's take a look at how to use the browser. If you go to browser.itsudotools.org, you'll find the SNOMED International SNOMED CT browser. You'll see that it lists both international editions. So the first one listed here is the core edition, which was published in July 2016. It also lists local extensions, so this is where countries have adopted it to meet their specific requirements. And as you can see, there is a Canadian edition which does include French Canadian terms. So let's go into the Canadian edition. Once in the Canadian edition, I'll point out a few of the features and then we'll look up the first term from our Let's Browse exercise. On the left-hand side, one of the first things you'll see is this view that shows at the high level SNOMED CT concept, followed by the core entries in the hierarchy. So we saw these in that diagram we had previously looked at, and they include things like body structure, clinical findings, environment or geographical locations, events, etc. Additionally, there are tabs up at the top that allow you to do searches. So you can enter a concept name or other qualifier, etc., and do a search on them. If SNOMED CT is something that you use frequently, you can also set favorites to make them easy to find. And then there's a tab for ref set or reference sets. This is something that you would use in more advanced work with SNOMED CT. So we're not really going to be looking at it within this course, but if you were working in SNOMED CT, it's an area you might use in the future. So moving over to the right-hand side, you can see that it's listed as concept details. So this is where you are given information about the concept itself. Right now, the summary tab shows what the parent is. So the parent is the SNOMED CT concept. And the first one it's looking at is clinical finding. You can see that it has a concept ID associated to it, so 404-684-003, and it gives the description, clinical finding, followed by the semantic tag of finding. Underneath, it provides synonyms for it. You can see also that there are children listed, so this has 31 children, and if you click on the link there, you can actually go and fully display the children. Under children, you'll find things like administrative statuses, which is a finding, adverse incident outcome categories, another finding, etc. So it lists all of these which fall under clinical finding. You can also look at the details, and this provides more information about things like what the preferred term is, what the acceptability of it is, and in this case, it's specifically the acceptability in the English Canada version. It also lists the French language reference set and shows what the acceptability is for the French language. The next tab up at the top is Diagram. And if we click on this one, it will show you a graphical view of how it fits into the hierarchy. There's not much to look at with this one, but when you look at other terms as part of the assignment, go in and take a look at the diagrams, and it will show you the relationships and where they sit in the hierarchy. The next tab is Expression, and this just provides you with some additional information on whether it's a pre-coordinated expression or it's from stated concept definitions. Again, this is a more advanced feature and not one we need to specifically know about for this course. Similar to when you looked at the taxonomy side, there is a tab for ref sets, so again, a more advanced features. There's a tab for members, so if the concept has any members associated to it, they would be shown here. And then any specific references that are associated with the concept. So let's go back to the left-hand side and look at the search function. And we're going to look up the first term in our Let's Browse exercise, and that term is year. So if you enter year, it will bring you up a list of terms. We're going to look at the first one. So if you click on it, you'll find that it updates on the right-hand side, and you can see year qualifier value. There is a concept ID, so 258707000. And under that, there are a number of synonyms listed. So YR, year, year qualifier value, and years. You'll notice that above this, there's parents. So this is a child and it's in a hierarchical relationship. And the parent of this is non-international system of units, unit of time. There are no children for year, so there's nothing underneath it. We can also look at the diagram of year. Again, this one looks very simple compared to some of the ones you'll see further down in the hierarchies. But it does show, here's your year with your qualifier value, and the parent to that is the non-international system of units. If we look at details, it will give you information about what the acceptability is, both in French and Canada. So the fully specified is year with qualifier value. So this gives you the description or the English version of it, followed by the semantic tag, and that's a preferred term. You will also see these ones that are listed as S, and they are the ones that are synonyms. So the first one that has a star beside it, so S star year, this is the preferred term. This is the one you should be using. However, you can see underneath that there's two with check marks beside the S, and that indicates that those are acceptable terms. They may not be the best choice, but they would be accepted. If you look back over here on the left-hand side, you will also see that it gives you the option to do a bunch of filtering. You can filter the results by language, so if you wanted to look up only English terms, or if you wanted to look at French terms, you could do so. You can also do filtering results by semantic tag, which allows you to hone in and look at things with a more refined filter. You can also filter results by module. So if you wanted to specifically look at items that were from the French module, you could do that. So we looked at the first entry, year. Let's look at the second one, years. When we look at the summary for it, you will find that it has the same concept ID 258707000 as did the previous one that we looked at. And this is because they're synonyms, they share a concept ID. So that's a quick overview of how to use the SNOMED CT browser. You're going to go on now and look up the rest of the terms in the Let's Browse exercise and document the SNOMED CT IDs for all of them. When you come back to this slide, you should have completed the exercise and looked up SNOMED CT IDs for all of the words listed. The first one we did look up as part of the demonstration of using the browser. So it is 258707000. The next word we had you look up was old, and the ID you would have found for it is 707-53007. Now, this one can be more confusing because you may have found that there was old, which was listed as old episode with a semantic tag of qualifier value, as well as old, which was just old with qualifier value. So the difference between these two is one refers to old with nothing else as being the age. One is an old episode, so something or an occurrence of a disease or a condition that happened in the past. You might have also found old age. And old age, while similar because this woman is an older person, does not exactly describe what we were looking for. Because in this case, if you look at what's in this ER poll, it says we're looking for an 85-year-old female, where old just specifically is referring to age, with no judgment as to whether it's an older person or a younger person. The next word we looked up was female, and the ID you should have found is 248152002. When you looked up female, you would find that there is female with a semantic tag of finding, as well as a term female that's female structure and a semantic tag of body structure. So the one we're looking for is female as a finding. And if you looked at the synonyms for that, you would find things that help to indicate what you're looking for. The parent was related to the biological sex, so this gives the indication that we're talking about female. The other female that's listed is female structure or body structure. And if you look at the description of that one, you'll see for that one that there are a number of children which indicate things like female genital urinary system structures or female mammary gland structures. So this obviously relates to the body structure as opposed to the sex. The next word we had was ER admission. And the ID you should have found is 508-49002. Now this one was a little more tricky because if you looked up ER admission, you would have not found anything in the term way of results. If you were to look up just the term emergency, you would find that there's a number of different terms that will come up for you, including some Canada-specific ones, such as emergency department. However, what we are looking for is not actually just the emergency department, but what we were looking for was the actual admission to the emergency room. In this case, if you entered the term emergency room, it would come up with a number of different terms, including one that was emergency room admission with a semantic tag of procedure. And that's the one we're looking for in this case because it does cover the actual ER admission. And as I said, the number for that was 508-49002. And if you looked at this one in detail, you would find the parents to it were admission to the department procedure and hospital admission procedure. And some of the synonyms for it were things like emergency room admission and admission to accident and emergency department, admission to casualty department. And under it, there's a number of different children, which, if you needed further specificity, would give you things like emergency room admission, dead on arrival procedure. Because if someone is brought in dead on arrival, there are different procedures that are followed within the emergency room than with a standard admission of somebody who's still alive. The next word we looked up was nursing home. You should have come up with an ID of 4266501. Nursing home was a more straightforward entry, and when you searched on the term, you would have found nursing home with a semantic tag of environment. The parents for it are nursing home and/or ambulatory care site, and it also has the semantic tag of environment. Some of the synonyms are nursing home environment, long-term care facility, NH-nursing home, and just nursing home. And there are also some children listed under it, charitable nursing home environment and private nursing home environment. Uh, in the listing, you would have also found NH nursing home as a equivalent or synonym to nursing home, and it has the same ID as the first nursing home we looked at. If you had gone down and looked at ones that are lower down in the listing, such as private nursing home, uh, it is a child of nursing home and provides some additional specificity if you had to be more exact in specifying that what you were looking at was not just a generic nursing home, but a private one. For shortness of breath, you should have found an ID of 267-036-007. And this was found by doing a search term of shortness of breath. When you do that, you'll see that there is shortness of breath listed, but it is listed under dyspnea finding. So it is a synonym for dyspnea. Within that listing, you'll also see in the search terms SOB, shortness of breath, which again is another synonym of dyspnea. You could have also gotten to the same result by just doing a search on dyspnea if you knew that term. And when you look at the concept for dyspnea, you'll find it has the semantic tag of finding. The parent is difficulty breathing, which is also under finding. And again, there are quite a few synonyms: dyspnea, dyspnea spelled differently, breathless, breathlessness, shortness of breath, and shortness of breath, SOB. Also associated with it are a number of children which can provide more information or greater specificity on what is being seen with that episode of dyspnea. For the next term, uh, although the ER listing said confusion, I asked you to look up onset of confusion to illustrate how very similar terms can be very different. So if you looked up specifically onset of confusion, you would have found 225-44008 as the ID. Onset of confusion is a finding, and it is a child under two different parents, both finding clarity of thought and mental state finding. And it itself has no children. If your approach had been just to look up confusion, you would have found a concept confusion, and you would have found that uh, it was described as being clouded consciousness finding. So confusion is actually a synonym for clouded consciousness with a semantic tag of finding. There's a number of other synonyms there, such as bewilderment, dazed state, dullness of senses, etc. Parents of clouded consciousness are disturbance of consciousness or a finding of mental alertness. And looking at this, there are a number of children under it as well. So acute confusion, chronic confusion, intermittent confusion, etc. So this one was just an exercise in trying to get you to look up something a little different to see how very similar terms such as confusion and onset of confusion can yield different IDs. So you have to be very careful when you are searching to look for precisely the terms that relate to what you are doing. The next word we looked up was congestion, and you should have found an ID of 858-04007 for it. So if you did a search on congestion, you would have immediately found two different versions of it that are both listed as a concept of congestion with a semantic tag of morphologic abnormality. One of them is just congestion, but the other has a Canadian flag beside it and identifies it as being one that is specifically within the Canadian localization of SNOMED CT. However, both of the two, congestion and the Canadianized version, do share the same ID, so they are equal from that perspective. When you looked up congestion, you would see the tag of morphological abnormality. There are a number of different synonyms listed for it. The parent was fluid disturbance, which is a morphological abnormality. And again, it does have a number of children, such as active congestion, acute congestion, functional congestion, etc. If you had looked up the Canadian version of this and you went into the tab for details, you would find there that in association with the Canadian flag indicating it's in that localized version, there are French Canadian terms for congestion, including the preferred term for French Canadian as well as for English Canadian. For no history of, you should have come up with an ID of 14732-006. When you look this up in the browser, this would have brought up a concept of no history of with a semantic tag of contextual qualifier. There are a number of synonyms listed. Some of them are in French, so they're part of the Canadianized version, and some of them are English, and they may include NH, no significant history of, or no history of contextual qualifier plus a qualifier value. The parents to this one are general information qualifier and special atomic mapping values. There are no children for this concept. When you did look this one up, if you had have used the exact search term of no history of, you would also find a number of other similar types of concepts from the search. So you would have found things like a number of ones that had a semantic tag of situation. So no history of migraine, no history of dizziness, no history of depression. So this allows for specific situations to be documented using this type of situation tag. In addition, there's also one that's no family history of, and that's one that's commonly used when doing things like documenting whether a patient has something like a family history of cancer. And finally, for history of, you should have found the ID of 392521001. Similar to no history of, there are also, when you do this search, a number of ones that are history of with a semantic tag of situation. So you'll find things like history of fall. That's a very common one in hospital and long-term care settings. History of gout, history of abuse, etc. So this can cover off history of many different things. When we actually look at the concept history of, um, it has a number of different synonyms. Some of them are French ones, so specific to our Canadian localization. The parent of it is General Information Qualifier with a semantic tag of qualifier value, and there are no children associated with it. If we look at putting this all together to look at this as an HR example and show what would be found both in terms of the text that would have been put into the EHR by the physician, as well as the translation into SNOMED CT type of terms, we would find it listed such as this. This 85 year, and the ID would be 2587070 year old, uh, with an ID of 707530007 old, female with an ID of 248152002 female, was admitted via the emergency room, ID 508490002 ER admission, from the nursing home 426650001 nursing home, with shortness of breath, 2670-36007 dyspnea, confusion, 22544-008 onset of confusion, and congestion, 8580-4007 congestion. There was no history of 1479-2006, no history of fever or cough. Patient also has a history of 392-521-001, history of senile dementia and COPD. As I'm sure you've noticed that we didn't look up all the terms that you might have in this example. So things like fever and cough we didn't look up, as well as senile dementia and COPD. We had enough other terms to give you an idea of how SNOMED CT works and let you have some experience with working with the browser. To round out this section of the module, we're going to look at a few slides on the integration of SNOMED CT. This slide is to give you a little bit of an idea about the complexity involved with terminologies and how choosing the right terminology is important. So the red rectangle in the middle represents an EHR, and within the EHR you'll find that there's a number of different components. You'll also find a legend in the lower right corner. So components that are in the goldenrod yellow kind of color are components of the health system. Ones that are in the green color are registries. Ones that are in purple are lab or diagnostic imaging or drugs related. And then the ones that are in the tan color are related to the IEHR. So if we look at just one of these, take for example the patient demographics one, you can see that in Canada, there are many different terminologies that are used associated with patient demographics. These include WHIC, the Alberta Standards, Stakeholder Demographic Standards, Healthcare Client Identification, etc. Similarly, if we look at one like lab test and lab result, you'll see LOINC, SNOMED CT, provincial billing codes, and ISO 31 and ISO 1000. So for each of these components, there are many terminologies which could be used. Um, One of the most important areas for us is IEHR. So the grouping that includes physical findings, allergies, treatments and interventions, and diagnostic history. As you can see with these, there are 12 or more terminologies that can be selected for this coding of clinical information. And these include things like ICNP, SNOMED CT, ICD-9, ICD-10-CA, etc. Each terminology has a different scope, different levels of granularities, and different inherent qualities. So while this looks confusing or, like there's significant numbers of them there, you have to keep in mind that in actuality, it's said that there's more than 100 different terminologies that could be selected from. So when you have this many different terminologies available to you, interoperability is clearly impossible if they're all allowed to be used, since multiple combinations of sending and receiving EHR data would require the creation and maintenance of dozens of different mapping solutions. Essentially, SNOMED CT has been chosen for the IEHR in Canada as it captures clinical information at the level of detail needed by clinicians for the provision of care in most settings by most disciplines. And you'll notice that there's a lot of most terms in that statement. No terminology is perfect for everyone, but the goal with trying to do interoperability is to select the one that is going to be the best for the most amount of people. Different terminologies suit different purposes. So we've talked earlier in these modules about the difference between the reference terminology or clinical side with SNOMED CT as being an input system and classification terminologies on the administrative side with things like ICD-10 and CCI being output systems. So neither a clinical reference terminology nor a classification can, on its own, serve all the purposes for which health information is currently used or will be used in the future. Terminologies and classifications are designed for distinctly different purposes, and they satisfy diverse user data requirements. A reference terminology standardizes clinical information to enable more accurate documentation of patient care, and it will enhance the reporting and analysis of medical outcomes. Essentially, the adoption of SNOMED CT is being recommended for the IEHR because it captures clinical information at the level of detail needed by clinicians for the provision of care. Because SNOMED CT was developed to support the recording and retrieval of electronic clinical information at the point of care, it does not replace the need for classification systems. Terminologies at different levels of granularity complement one another and can be aggregated from the detailed level to the more generic level. Since ICD-10-CA and CCI are classifications, not reference terminologies, they're not designed to meet the business needs of IEHR with regards to its core terminology, nor do they have the required level of granularity and comprehensiveness for clinical appropriateness. However, this is something that may change when ICD-11 is released. With the development of ICD-11, World Health Organization is partnering with ITSADU, and the goal is to incorporate SNOMED CT into the ICD-11 product. As mentioned, a single terminology will not fit every need. So it's important that you look at both the purpose of the terminology and the level of specificity, and this will aid you in selecting the right terminology depending on the usage. So if we look at this pyramid, you'll see at the bottom is reference terminology. And these tend to have hundreds of thousands of terms within them. They tend to be used primarily for recording and retrieval of clinical information. And these include ones like LOINC, SNOMED CT, etc. The next level up is classifications, and they include tens of thousands of codes. These tend to be used for epidemiological analysis and management purposes. And examples of classifications are ICD-10-CA and CCI. And you'll note that the EHR sits on the median between reference terminologies and classifications. And then at the highest level are groups. And groups contain thousands of groups, so again, a smaller level of detail. And these are generally used for resource management and as well funding purposes. So an example of these would be DPG or CMG. As you can see, a single terminology does not meet the needs of all types of health information, be that clinical, financial, administrative, or research. The degree of specificity of coded information for each of these purposes is different. Let's take a look at an example using this pyramid. If you look on the left-hand side of the pyramid, you will find that we're going to use an example of SARS, or Severe Acute Respiratory Syndrome. If we looked at SARS at the level of reference terminology, it's very specific. It's listed as an associated coronavirus disease, and in LOINC, it would be listed as L-30014, and in SNOMED CT, it would be listed as ID 243608008. If we move up a level into classifications, in ICD-10-CA, SARS would be listed as U04 Severe Acute Respiratory Syndrome SARS. Moving up again into the groups, we would find SARS listed under Case Mix Group 137, Respiratory Infections and Inflammations. And you can see by this that it would be then grouped with a number of different other infections and inflammations and looked at a much higher and less granular type of level. Let's consider a couple other different examples. If we were to look at provincial funding formula, it would not be effective if it was based on 350,000 different terms, such as would be typically found in a reference terminology. Nor would a physician be able to record clinical information regarding their patient in an EHR if it was based on the very generic codes which are found in a case mix group. The interoperable EHR terminology requirements are at the reference terminology level in order to meet the needs of the care providers. SNOMED CT is a very granular level, and it's required in order to span all of the disciplines and healthcare settings which are used for documenting at this level. Let's look at one final comparison between classifications and terminologies. So a classification such as ICD, when we were looking at hospital stays for newborns, would represent codes which identify the type of birth. So you would find things like live-born, single or multiple birth, vaginal or cesarean deliveries. So classification level is somewhat higher. If we looked at it in terms of clinical reference terminology, codes would describe the complete clinical detail for the healthcare encounter. So you would find things like codes for each component of the APGAR score. You would find separate codes for appearance, pulse, grimace, activity, and respirations. This is at a much more detailed level than you find in classification. What does all this mean for the HIM professional? Well, it means that communication of data between systems can be accurate and it can be efficient. You can enter things once and use it many times throughout the system. It also can be facilitated electronically. And there are applications which will help with computer assisted coding, or CAC, in ICD-10. And this is an area that is newer and just starting to develop, but is one that shows a lot of promise for the future in order to reduce the amount of manual work that coders have to do and allow coders to instead move to a higher level in what they're doing with coding, such as verifying the quality of that coded data. And finally, let's round this out by taking a little bit of a closer look at computer assisted coding. So, there are two ways that computer assisted coding can be done. The first is through structured input. So, this is generally done at the point of care, and it's often done by physicians or nurses. And what they try to do in this case is to limit the type of data entry that's done through pull downs or point and click. And this makes the data entry more standardized by providing lists of what the physicians or nurses can choose from. It will also prompt for more information when it is required, ensuring that enough detail is included. Selected entries are linked to codes, which enables them to be already generated as that information is entered. Also, it will present codes to the coder as they're working on coding. So rather than assuming the coder is going to know them all, it will offer up suggestions of here's ones that we think will fit with what you're putting in. And then the coder can select from those, which speeds up the process. It also fits best in procedurally driven specialties. An example of this type of computer assisted coding is Probation MD. This is contrasted with natural language processing. This is done via transcribed reports, and so normally the physician would dictate and they can continue to do that. It will take text that is less structured. Physicians and nurses really don't need to know anything about the system. They just do their work as normal. They're not doing specific entry at the point of care, and they don't have to contend with things like pull downs or specialized features of the application. Natural language processing imitates how people read and comprehend via artificial intelligence. So, when a physician dictates, it is sent over as a report to the NLP engine. Relevant terms are extracted, and lists of possible codes are generated. So, this system with natural language processing does a lot more of the initial work itself. What happens then is this listing is sent over to a coder who can do a validation of the codes that were selected. And if they do find anything that doesn't match up, they can make those changes. An example of natural language processing software is Optum LifeCode. We've covered a lot of content in this module. There is a little bit of a reference in the CHIMA text for you on pages 60 to 62. Additionally, you should go out and watch the two videos listed here. These are an introduction to SNOMED from the ITSADU chief terminologist, and they will enhance what we've done in this lecture and to give you a better understanding of SNOMED CT. Also, you'll find in D2L, I've included the CHIMA SNOMED CT primer, and that's up there for reference only if you're interested in SNOMED CT and you want to do some further reading on it.